Hey everyone, welcome to Canadian politics. Depending on how you feel about safe injection sites, you probably walked away from Pierre Poilievre's press conference with a very different impression. If you lean more towards the right, you were likely shocked that a safe injection site was built next to a school and agreed with Mr. Poilievre's concerns. If you lean to the left, you were likely more focused on the inaccuracies of his talking points when it comes to funding these sites and lack of empathy or foresight in the harm reduction space. What if I told you you were both right? Let's start with the headline grabber, the safe injection site in Montreal's Saint-Henri neighborhood. It was built within 100 meters of a school. The proximity to a school is not ideal. At a minimum, it seems like municipal laws should have prevented this. There are bylaws preventing marijuana or alcohol retail stores from being within a certain distance of a school. It's unclear if this bylaw didn't apply due to the facility's original scope, or if there was an exhaustive search for such a location and nothing was available. It's understandable that it would be difficult to get an ideal location in the heart of a large city like Montreal, but that is faint comfort to the parents of the students of the nearby school. These are legitimate concerns, and it's going to take a thoughtful plan to calm the fears, whether that be security, increased police presence, or some other plan. Mr. Poilievre has said that he wants to cancel funding for safe injection sites and get rid of existing sites. This is a misinterpretation of the federal government's role. The federal government doesn't fund these sites. The government's role is to provide an exemption for a site. The funding comes from elsewhere, usually a combination of provincial, municipal, and non-profit funding. It's true that the federal government can stop granting exemptions. This would mean that no additional permanent safe drug sites could be built. However, that isn't the end of the story. Provincial health ministers may establish urgent public health service sites. These would not formally be permanent safe drug sites, but could perform the same role and are completely out of the purview of the federal government. While it's understandable to be concerned about safe drug sites, there are also a lot of benefits. According to Health Canada, the benefits of these sites are as follows: to reduce the risk of accidental overdose because people are not rushing or using drugs alone, to connect people to social services like housing, employment assistance, and food banks, provide or connect people to health care and treatment, to reduce public drug use and discarded drug equipment, to reduce spread of infectious diseases such as HIV, and to reduce the strain on the emergency medical services so that they can focus on other emergencies. These things can actually help save taxpayers money by lessening the burden on our hospitals and health system. When it's all said and done, it's not a simple issue. There are legitimate pros and cons that can't be distilled into a 30-second soundbite. Making it policy to not give exemptions in the future isn't going to solve the current problems of drug use and homelessness. Likewise, we can't put vulnerable people in jeopardy. New sites being further away from schools seems like a reasonable request. There is much needed investment into mental health services. In some ways, it feels like we're treating the symptoms rather than the disease. But, on the other hand, a pragmatic case can be made for the use of safe drug sites too, especially when you compare its cost effectiveness versus a hospital visit. Nothing is quite as cut and dry as we would like it to be when it comes to Canadian politics.